Germany now has some of the world's strictest rules for people who are not fully vaccinated against COVID-19. The country also has a vocal minority who refuse to get the jab. Many subscribe to conspiracy theories and call themselves querdenkers or transgressive thinkers. They've been protesting against the increasing rules in Germany, and now many are so fed up, they're leaving. Some anti-vaxxers are now looking to get away from the lockdowns and restrictions of their homeland, even to places as far off as South America. Hello and welcome to Deutsche Welle's COVID-19 special. I'm Stephen Beardsley in Berlin. With every wave of COVID-19 illnesses in Germany comes a new backlash from those strongly opposed to the health measures taken in response, including vaccination. Protests and refusal to wear a mask in public places are the actions that most commonly take. Some, however, have gone to more extreme measures.
Olga and Vola Kohn came to Hohenau in December 2020. It's a small town with around 15,000 inhabitants in the south of Paraguay. It was founded in 1900 by German settlers. The Kohns appreciate the peace and quiet here in the countryside. The Kohns emigrated from Stuttgart in southwestern Germany to Paraguay, together with Vola's brother and his wife. They say they can lead a free life here without COVID restrictions, staying healthy for many more years. We have more time for ourselves. That's what it looks like. Keeping animals, growing our own plants. Just living freely, that's the plan. More than 1,000 people have moved from Germany to Paraguay in the last year. The Kohn brothers want to set up a business repairing cars like they did in Germany. They hope they can have time for their family life outside of work. In Germany, both of us were employed. We both worked. The kids were in school and in kindergarten. We hardly saw each other, sometimes for 2 or 3 days, because I had to work more to earn money. Some of those who have emigrated here are turning their back on COVID restrictions in Europe. Vitali Fuchs, who now works as a pastor for the community in Hohenau, explains the high number of migrants with his religious perspective. And then I found Paraguay on a world map, and God said, "The time has come and you will be there." And as it was said, so it came to pass. I also led an online forum, and my subject was a wave of migrants to Paraguay. Other members of the German community in Hohenau, like Inge Hase, who arrived a few months ago from the US, are much more forthcoming about their rejection of the COVID measures and vaccines. All of that isn't something Paraguay should go along with, she says. I decided to come here because we noticed that through this coronavirus situation, everything was tightening up, becoming more difficult, because more and more people actually had to flee Germany, Austria, and Switzerland. They lost their jobs, and soon they won't be able to go out shopping. And now they're announcing a vaccine mandate. It still remains to be seen just which COVID measures Paraguay will implement in the course of the pandemic. Until then, the emigrant families will try to find their new home here.
Andreas Zick is professor for socialization and conflict research at the University of Bielefeld here in Germany. Professor, thank you for joining us on the show. Would you ever have imagined that it would get to this point where people would actually immigrate overseas because of COVID-19 measures?
No, the immigration of groups, especially families, is not a new pattern. Members of the protests have already emigrated and supporters live abroad. They've emigrated to reasons of conviction as well as to escape prosecution. So we have enclaves, we have some enclaves in Canada where a former journalist offers real estates. We know that one of the most radical spokesmen is now living in Turkey. We know the formation of diaspora communities historically. It's one of the strategies of the protesters and the deniers to cope with the situation. But what is now relevant is to observe what happens in these colonies. Is there further radicalization? Are they producing propaganda? And we need to link it to the multiple forms of protest in the emigration. It's one part. The social media offer a lot of possibilities to create these parallel societies and communities.
You said that it's just one part of this protest. Does it tell us something important about the intensity of the opposition here in Germany and other countries, or is it fringe? How would you look at it?
No, we would say that this is one element and maybe the last step in the process of radicalization. So the one group is leaving the country, the other group are further radicalizing into a polarized ideology and into violence. When we speak about radicalization, I speak about radicalization into ideology and violence, but this emigration is one part. It's a central element. Why? Because the distancing to the former system, the distancing to the former networks. So the distance to traditional and majority norms and rules is one of the most relevant elements in this radicalization. And it's growing. We saw in the last week, we saw around 50,000 people in Germany in the streets. We have over 33,000 right-wingers who count themselves among them. We have network of the corona deniers. The studies by the universities of Vienna and Edinburgh estimate that nearly 9% of the population in Germany belong to these deniers. And it's a very heterogeneous group, and the distance is a central element.
Not too long ago, in fact, we saw a torchlight march in front of the house of the health minister in Saxony. That's a German state.
Yeah.
Do you expect to see more violence, especially as we near this debate on a vaccine mandate in Germany?
There is a clear evidence of further radicalization when we define radicalization as extreme ideologies and violence. We have an increase in public statistics in group-based and racist-based hate crimes. We see many protests. It's not that the amount of people is increasing. So the corona protests in 2020, we saw huge protests, but now it's going very much local, and the people who are now in this movement become very extreme. And the mandatory vaccination, the topic of mandatory vaccination was always the bridge to the center of society. So, for example, in spring this year, we run a representative survey in Germany, and 70% in this representative survey agreed to the statement, Corona is used compulsory vaccination, and 18% partially agreed. And this mandatory vaccination is not perceived by the protesters as something which is good to fight the coronavirus, but it is a complete giving up of their freedom, and it's increasing the idea we have to show resistance right now. We are losing all our rights.
All right. Andreas Zick is a professor of socialization and conflict research at the University of Bielefeld here in Germany. Thank you very much.
Thank you very much.
Now it's time for you to ask and us to answer. Here's a viewer question for our science correspondent, Derek Williams.
Why do I need a COVID-19 vaccine if it doesn't prevent me from catching the disease?
I think that this question, more than any other, illustrates how governments and healthcare authorities have really struggled with messaging in this pandemic. To answer it, let's go back over some of the stuff that they could have probably communicated better. First, I think, is the fact that despite really great efficacy numbers from clinical trials, the vaccines that we have are not perfect silver bullets, and we should never have expected them to be. What they have so far proved to provide is some very effective short-term protection from serious illness and death caused by COVID. It would be great if that protection were indefinite, but there are indications that it might be less long-term than we'd hoped. One recent model-based study that's gotten some attention posits that if SARS-CoV-2 becomes endemic, then reinfection in people who got it once could on average occur again in just 16 months. Now, if correct, that obviously has implications for durability of immune response in vaccinated people as well. But that's just one prediction. And over the course of this pandemic, it feels like those have proven wrong a lot more often than they've proven right. So I would encourage people to focus more on what we really do know now, like the crystal clear data-based statistics published by the CDC in the US. They've showed that although vaccines haven't prevented COVID-19 or its spread completely there, unvaccinated people are still 5 times more likely to test positive for the disease than vaccinated people are. And more importantly, unvaccinated people are 10 times more likely to end up in the hospital and 10 times more likely to die. So does being vaccinated guarantee you won't get COVID-19 or maybe even die from it? No. But for at least a while, maybe a long while, vaccines certainly do stack the deck a lot more in your favor.